Hi, I'm Dr. Noga Minsky, Director of Diabetes Technologies at Sheba Medical Center. In honor of World Diabetes Month, I'd like to share some important information with you. Insulin is a hormone made by the pancreas, which drives glucose into the cells and lets us use it for energy. If we don't have enough insulin or we're resistant to the insulin, then we're having very high glucose levels. That sugar in the body starts to bind to things and causes all sorts of damage. And also we don't have enough energy or fuel to burn. So diabetes essentially is a problem with managing glucose in the blood, and it's due to multiple mechanisms. The body often cannot handle the insulin well. It is resistant to insulin. The cells don't respond to this hormone, which is supposed to get glucose into the cells. And there also can be a problem in producing enough insulin in the pancreas. So a lot of people don't know there are actually lots of different kinds of diabetes. The one you're probably most familiar with is type 2 diabetes, which is the most common, and that's caused by primarily resistance to insulin, where insulin is not working properly, it's not received properly by the body. That's the most common, but actually it turns out that up to 40% of people who are initially diagnosed with type 2 diabetes, they're misclassified and they actually have type 1 diabetes. So type 1 diabetes is actually present in 5 to 10% of people with diabetes. And it's autoimmune, where the body's immune system is attacking the cells that make insulin in the pancreas. And it's really important to know if you have type 1 diabetes, because that requires more complex insulin replacement strategy, and there are different things to watch out for. Now, we do suspect type 1 diabetes more often if the diabetes is diagnosed before age 35, if people with diabetes progress to requiring insulin within 3 years of diagnosis, if they have a personal history or family history of other autoimmune conditions. One misconception is that everyone with type 1 diabetes is really thin and young, but actually more than 50% of new diagnoses of type 1 diabetes actually occur in adulthood. And just like in the rest of the population, obesity and overweight is common now in people with type 1 diabetes. So it's really important to know if you have diabetes, because it's a leading cause of blindness, foot amputations, kidney failure leading to dialysis, and it really reduces lifespan. We have something called prediabetes. Many people don't know they have prediabetes, which is defined as having fasting glucose between 100 to 125 milligram per deciliter, or hemoglobin A1C between 5.7 to 6.4%. Those are routine tests that many people have and often are not discussing with their doctor. And something you might not know is actually most people who are diagnosed with prediabetes, particularly if they're diagnosed not when they're elderly, they will go on to develop diabetes. There's a lot you can do to actually stop that from happening. So doing exercise at least 150 minutes a week, eating right. So the Mediterranean diet is something we promote. So a lot of non-starchy vegetables, fruit, lean proteins, legumes, fish, nuts, and less on the refined starches, unhealthy fats, processed foods, and meats. Besides that, trying to maintain a healthy weight. So if you have overweight or obesity, try to reduce your weight by at least 5%. Now, there are a lot of great potent medications that can promote healthy weight and very significantly reduce your risk of progressing from prediabetes to diabetes by up to 94%. You may be wondering, when should I suspect if I might have diabetes? So common symptoms are feeling like you have to urinate a lot, being very thirsty. Sometimes you may have weight loss or blurry vision. So if you have any of those, go ahead and ask for a blood glucose level. So if you were diagnosed with diabetes and you're not sure if it's really type 2 diabetes, either because you were diagnosed young or you have very poorly controlled diabetes, you have a personal or family history of autoimmune conditions, you're not overweight, then I strongly encourage you to seek consultation with an endocrinologist.